Good evening, everyone. I'm going to have everyone give me a thumbs up or comment in the chat if you guys can hear me okay. And once I see everyone can hear, we'll get rocking and rolling. Good. Got a few saying they can hear me. Perfect. So looks like a handful of individuals say they can hear me. So if anyone's having trouble, just drop a comment. And if enough people are having some problems, I'll look and see if something is wrong on my end. Otherwise, we'll get rocking and rolling, and I'm sure people will trickle in as we get started. Thank you so much for everyone spending your Tuesday night with me. I know there's a lot of things you can be doing. I think the Bachelorette's on tonight. So I am pleased that you are choosing to listen to me rather than watch The Bachelorette. I appreciate that. So I'm Dr. Perry Maynard. I am one of the clinicians at Integrated Health Systems. And tonight's discussion is on peptides and peptides in chronic health conditions. And some of you may be familiar with peptides. If you're at all into the anti-aging regenerative world, you probably would have heard of peptides for sure. They're kind of like a new big buzzword, being thrown around on podcasts and books and by doctors kind of all over the place. So I'm going to talk about them a little bit tonight. We're not going to go crazy in detail. There's so many different peptides, but give you a kind of an idea of what they are. Because a lot of individuals think peptides are those proteins. Is that just like me eating collagen? What does that really mean? So before we get started, I'm going to quickly talk a little bit about myself for those of you who may not know me. I definitely see some names that I'm not familiar with. So like I said, I'm Dr. Perry Maynard, and I am one of the head clinicians at Integrated Health Systems. So Integrated Health Systems is a clinic that is made up of a variety of different practitioners. It's myself, Dr. Stedman. We have Jolene, who is our nurse practitioner, Dr. Terry Trinka, who is a optometrist specializing in traumatic brain injuries. We have Jake, who is our wonderful psychotherapist, nutritionist on staff, craniosacral therapist. So what we've really tried to do at Integrated Health Systems is truly, like the name states, integrated, is try to create a multidisciplinary clinic that focuses on chronic health issues, but especially traumatic brain injuries. Or myself, specialize largely in traumatic brain injuries, neurological disorders, and autoimmune diseases that can affect the brain. So, that's not all we see, but that's a majority of the type of patients I see. So it's really cool to have a clinic of different practitioners so we can come at it from the functional medicine and immunology side, from the rehab and physical medicine side, and kind of bring that all together, right? Because the big problem I see, especially in the world of chronic health issues and especially TBIs, is there's a lot of clinics that just have tools. Maybe there's a clinic where they do laser, or a clinic where they do cognitive behavioral therapy, or a clinic where they do vision therapy, and that's all they do. And everyone that comes in, that's the tool they get because it works for a majority. So they think, must work for all people. And what we do a little bit differently is say, we realize that all those things have merit, but they have merit at specific times. And what really makes a difference in an individual's recovery is the right treatment at the right time, right? It's those individuals that get better in a few weeks or a few months versus years, right? Because they got to the right clinic at the right time and they got the right intervention. And when you really start to see it clinically time and time again, it no longer becomes a shooting in the dark. Things kind of make sense, and people start to get better quicker because we're implementing the right strategy, right? And we're creating a team approach with all the different practitioners in and out of our clinic. So that's a little bit about Integrated Health Systems and myself. So let's get rocking and rolling. And for those of you who have questions, feel free throughout the conversation to just put them in the chat. And at the very end, we'll answer all questions, okay? But if you have questions that pop up in the middle and you're worried about forgetting them, just put them in the chat and I'll get to them at the end. So let's talk about peptides. But before we get into that, let's talk about chronic illnesses, right? And for the longest time, people would say that inflammation was a part of 80% of diseases, right? Or chronic diseases, which is completely true. But I think we can elaborate that on a little bit more, is saying that immune dysfunction or the immune system is truly behind a majority of chronic illnesses, right? Because ultimately that's where inflammation comes from. Inflammation is an immune driven process, right? If we, cut our hand, we need acute or early on inflammation to bring certain immune cells in to heal that tissue, right? The problem is when we have a dysfunctional immune response throughout the body that maybe isn't modulated appropriately, it's hyper responsive, that's when we get chronic disease, right? And you're seeing it with COVID currently right now. We're not going to go down that rabbit hole, but alterations in individuals' immune systems, right? There's dysfunction or hyper responses in certain individuals, right? But it's difficult to kind of identify who might fit into that category. But a current day situation of altered immune function in individuals is how you're seeing different people respond to the current virus. But if we look at chronic illness, you'll see things like depression, post-concussive syndrome, things like cancer, autoimmune disease, neurodegenerative diseases, insulin resistance, and just the aging process in general drives immune dysfunction. Chronic fatigue, chronic pain, and food allergies all have a basis in dysregulation in the immune system. Now, once again, is that to say that all depression is just immune dysfunction? Not necessarily. There can be different things from genetic abnormalities, how people process neurotransmitters, was there a concussion, but largely the immune system tends to be involved in all of these systems because once again, the immune system makes everything run. It plays a role in healing tissues after a brain injury. It plays a role in inflammation, all those different things. So what we're going to talk about to start is a little overview of what the immune system is. We're not going to get super in depth, but before we get into peptides, I want to give you an idea or basic, quick review or education on the immune system and simply how it works. So when we get into peptides, these interventions will make a little bit more sense. So I apologize. This image was clear, and now that I bring it up here, it is not that clear. So really, when we look at the immune system, we have two different arms to keep it simple. We have our innate immune system, and we have our adaptive immune system. Okay, our innate immune system lives within our skin. It lives within our gut, our eyes. So pretty much think about any barrier system, any system that keeps bugs from the outside and your inside has cells for your innate immune system, right? And this is where, if you eat something you shouldn't and it triggers an immune response in your gut, the first line of defense is your innate immune system. If you get a respiratory illness or you get the flu, it's your innate immune system that first comes to the response, right? And that's where you have, your neutrophils, your monocytes, your eosinophils. So if you were to get kind of standard blood work or what's called a CBC or complete blood count and look at white blood cells, you're going to see a lot of innate immune markers. Okay. So these are the initial things that fire off, right? And they start to gobble up the pathogen and then they present the pathogen to the adaptive immune system, right? And the adaptive immune system is largely made up of T and B cells, right? Or lymphocytes or lymphoid tissue, right? And these T and B cells are really going to be what's largely important when it comes to peptides and their immune modulation. And we'll talk about those a little bit more, but the adaptive immune system is what helps to target and then continue to neutralize pathogens and create antibodies, or in the case of cancer, recognize tumor cells and kill tumors, right? And that's why, immunotherapy seems to be a promising field in, cancer research and also immunology. So what I want you to just remember is we have the innate immune system, which is the initial response, and then we have the adaptive that happens later, which is where we create antibodies. And really the inner workings between these two systems is really what makes or breaks it, right? This is once again what can, when there's dysfunction between these two systems, lead to things like autoimmune diseases, vascular disease, diabetes, neurodegenerative disorders, cancer, like we talked about. All of these are when there is dysfunction between these two systems and kind of how they communicate with each other. Okay. So kind of reviewing more, like we said, the link between the innate and the adaptive immune system is extremely important. So if we're talking about, let's say, infections, you have certain cells that gobble up that antigen and then they present markers on their cell. So for those of you who have been paying attention to the vaccine race for COVID, right, you hear a lot of people talking about the spike protein, right? So certain viruses or bacteria or things will present with different receptors, right? And the whole idea is to take the spike protein or receptor that is usually placed on the outside of cells. It's kind of like a, hey, look at me, right? And the immune system's got to be able to recognize that as an invader, okay? And the better the immune system, so the innate immune system will bring that to the adaptive immune system and it will say, hey, here you go. And the other side of the immune system will say, perfect, let's make an attack against this guy, okay? So in a healthy environment, that handoff goes off perfect. So you have an infection, you hand it off to the naive T cell or a T cell that doesn't really know what it's doing yet. It's kind of like a non-specialized, let's say, doctor. And then you say, hey, we're going to call in the cardiologist or we're going to call in the neurologist. And then it gets specialized to fight whatever it needs to fight, whether that is a cut on the leg, cancer, or an infection, right? Where we get into some trouble is when we have things like excessive damage to tissue, right? So going back to the example, currently, if we have a, lung infection that is creating a lot of debris or damage within the lung, right? When you bring that tissue, you have to bring that tissue to the immune system to say, hey, look at this debris tissue, right? But what happens is you'll bring that with the infection, right? So say you have a viral infection in your lungs and it's damaging the tissue, your immune cells, or what are called your neutrophils or macrophages, will bring that to the adaptive immune system and say, hey, look. And what can be difficult if that system doesn't work well is that the adaptive immune cell or the T cells may say, I don't really know which is self and which is a virus, right? And that's where you get into a tricky situation. And that's one of the proposed theories behind autoimmunity. There's a handful of different ones, but this is one of them, where there becomes an issue between the handoff between the innate and the adaptive immune system, right? And when we get into peptides and some of these things, this is where these come into play, is regulating the immune system. It's not necessarily about stimulating it or suppressing it. It's getting it into homeostasis and getting it to respond how it should. Okay. So I want you to kind of know how it roughly should look like. And then when it doesn't work, this is how it leads to, once again, things like autoimmunity. Just a side note, you hear a lot of talk about, vitamin D, things like that. What's interesting is that vitamin D is researched a lot in autoimmunity and different things. And one of the mechanisms or proposed mechanisms is that it helps with this handoff. It helps make that handoff between the innate and the adaptive immune system a little bit smoother, or decrease the risk that the response doesn't go off well. Okay. So that is a quick little overview of the immune system. Before we get started as well, we're going to look here. So like we talked about, I know this is a very busy slide, so don't worry too much about it. But like we talked about, you have what are called T cells. And T cells are a part of the adaptive immune system, right? The type of immune system that helps with antibodies and fighting the infection. This is important because when we look at peptides, peptides are going to affect the different types of T cells. So to keep it simple, you have about 9 different subtypes of T cells. We're really going to only talk about 4. There are 4 that are most largely studied and talked about when it comes to autoimmunity, chronic disease, infections, cancer, things like that. So we have a naive T cell, right, which means it just doesn't know what it wants to do yet, right? It's kind of like a kid who's going to college and they don't know what they want to major in yet, okay? But they have the option to turn or to major into different topics. So we have what are called Th1 helper cells, and those play a huge role in that innate immune response, okay? They play a role in helping to kill the infection early on, right? They produce inflammatory chemicals, all these things that are really, really important, okay? And there's different signaling molecules that help to signal that. So this is also, once again, important with peptides, is that for T cells to mature into other cells, they use what are called cytokines. Once again, you're hearing cytokines a ton in the news right now as a negative with COVID of a cytokine storm, but cytokines aren't bad or good, right? It depends on the context. They're signaling molecules, okay? So different signaling molecules will cause you to mature into different types of T cells. And once again, this is where peptides are going to be into a play because they can stimulate different types of cytokines so you can get different types of T cell responses, okay? So the Th1 cell plays a little bit more of a role in certain pathogens, and that kind of initial immune response. When we look at things like Th2 responses, you see these a lot in kind of the second stage of infections in the resolution phase of an infection, but also you see it with asthma and allergies, things like parasitic infections. Then you have what are called Th17 cells, right? And these are being more and more recognized as the type of T cell that plays a big role in tissue damage and autoimmunity. So we used to point the finger a lot at Th1 cells with autoimmunity. We're now starting to realize that it's more Th17 cells. Once again, looking at COVID and some of these things, we're seeing alterations in or kind of maturation into that Th17 phenotype, which can lead to tissue damage. Now, once again, all of these are important. It's about keeping them in homeostasis or balance. So you don't necessarily want to get rid of one, but when you have a dominance in one or system driving in one direction, it creates imbalance, right? And that can lead to chronic infections, chronic inflammatory conditions, once again, autoimmunity, all these different things. And then finally, what you can see is Treg cells. And Tregs are something that's really talked a lot about by a lot of doctors and clinicians in the autoimmune world because they help to mitigate autoimmunity. They kind of balance everything out and create what's called tissue tolerance. So keeping your immune system from attacking its own self, which sounds like a good thing. And in most cases, it is a good thing. But once again, there's always too much of a good thing. When you look at things like certain cancers and things like that, there tends to be a dominance in T regulatory function, right? Because Treg cells, they don't necessarily have an immune suppressive standpoint, but they decrease that Th1, Th2, Th17, some of that inflammatory component. And it's actually one way where viruses or cancers will evade the immune system is they'll create more production of Treg cells. So I bring this up in that a lot of people talk about, well, you just want to drive this, or you just want to do this, or take that. There's always nuances to it, right? And there's nuances to patients that we have to understand and realize that you do things calculated and specifically. And just because Treg cells are good for autoimmunity doesn't mean they're good for every patient, right? But roughly, those are known in the field as being good for regulating autoimmune disease. So once again, these are 4 big types of T cells that are really important when it comes to understanding how peptides can fit in. So like we see, there can be big inflammatory drivers, which is where a lot of this can fit in. So things like blood sugar, chronic stress, overtraining, poor sleep, certain types of infections, and then you can see some kind of lab markers as well. So we'll skip past this. So let's talk about peptides, what everyone came here for. Okay, so what are peptides? So let's take a quick look. So we have what are called amino acids, which some of you may be familiar with, like things like tryptophan or methionine, or leucine or phenylalanine, right? So these amino acids are the building blocks to proteins and to peptides, right? And all peptides really are amino acid sequences between about 2 and 50. So they're just short amino acid sequences, right, which when bundled together can make up proteins, and proteins are just longer strands of amino acids. So really it just comes down to sequence and the amount of amino acids. Once again, amino acids are things where you see like branch chain amino acids, or you'll see in your collagen. What the big key is, the combination of the type of amino acids and in what sequence makes different types of peptides, and then depending on the length, that makes proteins. So we're concerned tonight about peptides, right? And peptides are naturally occurring throughout the body, and they act as signaling molecules, just like proteins. They turn on and off pathways and activate different things. So think of peptides as signaling molecules throughout the body, okay? So we're going to talk really about 2 peptides because I want to focus because, like I said, there's so many different types. And we're going to talk about ones that have to do with the thymus or the immune system. So what's called thymusin. Okay, so thymosin is a hormone naturally secreted by the thymus. So the thymus is a gland that sits kind of around your neck. So if kind of you go down south from your thyroid as you get to the top of your chest, or for some of you in healthcare, the manubrium kind of sit right under there of the chest, between kind of the neck and the heart, you have the thymus, right? And it's a gland that produces all sorts of immune cells, so T cells, and that then turn into maturation of B cells and different things. So, and we know that your thymus, as you age, doesn't do as good of a job, so it loses function. And this is some of the thoughts behind immune deficiency in elderly individuals. So, thymosin, like I said, plays a role in stimulating T cell production. It assists in development of B cells into what are called plasma cells, and it's very important for antibody production. Okay. So, one of the big peptides we're going to talk about that has a huge immune modulatory effect is what's called thymosin alpha 1. Okay. This is a 28 amino acid peptide. So, like we talked about, between 2 to 50 amino acids makes up a peptide. This is a peptide that's 28 amino acid length, and it has a very specific sequence, kind of like, like we learned DNA, where you have different base pairs, and, it's kind of like maybe it's a sequence of like A, B, C, D, E, or A, C, B, D, and depending on the sequence, it codes for different things, okay? And thymosin alpha 1 is really, really interesting because it seems to have more of a role in immune modulating properties. So it's got a little bit of like an immune stimulating property, but seems to come in on the back end and have more of a modulation, which is really, really cool. So it enhances T cell production and antibody responses, but also modulates the cytokine response. So remember, we talked about cytokines are chemical signalers throughout the immune system to signal, let's get ready for an infection. Infection's gone, let's settle down. We have a cut, we need to send blood to that cut. Okay, the cut is healed. Let's now settle down. And then it also has a lot of anti-tumor effects. So let's get a little bit deeper into thymosin alpha. Let me make sure I didn't skip anything. There we go. So these are the things currently that thymosin alpha 1 is being studied for. Okay. So in the research, and there's a decent amount, first thing is that's actually kind of interesting, is that it has been used as a vaccine adjunct. So it's been used in vaccines to help improve immune responses to the pathogen that's in there. So in a lot of influenza vaccines and things like that, which is really cool, to help with the immune system work or respond a little bit better and safer to the vaccine itself. So really, really cool. I thought that was. It's used in cancer and as a chemotherapy adjunct, and an adjunct in some immunotherapy. So there's some interesting trials coming out in regards to that. It's used a lot in AIDS and HIV, hepatitis B and C, and chronic viral infections. And thymosin alpha 1, I think, is approved in 30 different countries for these different conditions. So it's a pretty widely studied and used peptide. And what's really cool about it, it seems to have a very good safety profile, right? So there hasn't been really a lot of negative documented effects, and I think a lot of that is because it's an already naturally occurring peptide that just plays a role in modulating, right? So you're just kind of adding a modulation signal to the system. You're not necessarily inhibiting or pushing things in a specific direction, okay? So here's a really cool picture that I like that I think helps to kind of tie everything together. So if we're looking at this picture, you can see on the right, you can see a virally infected cell. You can see a tumor cell. And then on the left, you'll see kind of the stem cell, and then it's differentiating into different T cells like we talked about. So you see the T helper cell, and then you have what are called cytotoxic T cells, and then natural killer cells and B cells. So it's kind of ramping up that initial immune response to help either kill a tumor cell or a virally infected cell. And then you can see it's got things where it promotes certain specific cytokines or chemicals, and then it will inhibit or modulate other ones. Okay. And then it also plays a role in modulating the expression of different receptors on cells so that your immune system can recognize it a little bit better. So once again, this is a really cool picture where you can see the direct antiviral and anti-tumor action, but also the immune modulating action of the peptide as well. So I think it's a really cool picture that kind of summarizes all the jargon we talked about. Okay. some of you may be familiar with this picture. Any of those who have been into our office, I'm sure, have seen this. This is an oversimplistic view, but when you're looking at imbalances in the immune system, especially autoimmunity, you get polarizations in those T cells, like we talked about. Maybe a dominance in more of a Th1 response, or a Th2 response, or a Th17, or a Treg response, like we said, right? And that's the goal, is to really say, where is that patient sitting in that dominance, or where do they seem to be stuck, right? And how can we bring that into balance? Because these things aren't bad per se, but they need to be in balance. You don't want too much of one of these things. So these peptides can play a role in bringing into balance that Th1 and that Th2 side of the immune system, and bring that homeostasis and bring that balance into immune function. Here are some future conditions that it is currently being studied for, and I know clinicians are using it for currently, is Lyme co-infections is a big arena. Chronic infections, which makes a lot of sense and is largely kind of what we are using it for. Things like chronic fatigue, which makes sense going back to chronic infections, autoimmune disorders, the aging process in general, which has a ton to do with alterations in immune cells, cancer, and immune deficiencies. Some of the biggest and coolest stuff, I think, is in immune deficiencies and HIV, like we talked about. But where we're kind of, using it is more of that region of autoimmune conditions and chronic infections, things like Lyme. Like we talked about, the problem sometimes is that those infections, going back to this slide, some of those infected cells a lot of times can suppress all of these immune cells you see on the left. So some individuals with chronic infections may have lower counts of T helper cells or cytotoxic cells, or what are called CD8 cells, or they may have lower amounts of natural killer cells. And these are all things we can test and see. So as we use certain therapeutics or peptides, we can look at these levels and say, hey, natural killer cell function seems to be coming back, or T helper cell function seems to be coming back, right? Because these viral infections, things like EBV or mono or Lyme or things like that, can come and suppress those, right? So we need different tactics to try to overcome the suppression from some of these infections and ramp up this immune system. But at the same time, we don't want too much inflammation. So that's what's cool about the peptides, is they create more of that modulating effect on the back end of, hey, let's get over or through this infection, but then let's calm it down as well, right? Versus just getting stuck in that vicious loop of inflammation that so many patients get stuck in. Okay. The other peptide we're going to briefly talk about is what's called Thymusin Beta form. And this is one I'm really interested in when it comes to tissue repair healing, especially for traumatic brain injury. So Thymusin Beta is largely studied in things like wound healing, kidney damage, liver damage. It plays a huge role in activating your body's own internal stem cells and sending them to tissues that need new growth. Plays a role in angiogenesis, or the growth of new blood vessels, cell migration, and then also has a lot of anti-inflammatory properties and modulates that cytokine response. So when we look at thymosin alpha 1 that we just talked about, that plays a huge role in modulating the immune system, but also stimulating it. Thymosin beta 4 plays a different role in that it increases healing of tissues. So if we look at something like a traumatic brain injury, you look at things like stem cells, which are really cool and promising, but they're crazy expensive. You could pay anywhere between $5,000 to $10,000 for one round of treatment, and who knows if it will actually do anything. Versus using some of these methods that are far cheaper, that can activate your own endogenous or your own internal stores of stem cells and force them to turn into certain types of cells that we want to create that healing process, but also to increase things like blood flow. And what I'm really excited about is to be able to link things like this with hyperbaric, with other therapeutics, where we're doing things in a synergistic manner to really increase healing. We're doing multiple things to improve blood flow to different tissues, whether it's a damaged leg, whether it's a brain injury, whether it's a thigh, whatever it may be. Find ways to multiply the healing process. So this is where I think thymosin beta comes into play, is healing of tissues. Okay. As you can see here, potential applications you can see in HIV, AIDS, influenza, colds, and infections, is being used somewhat prior to surgery and post-surgery, going back to the wound healing. inflammatory conditions, and then, like you said, healing from any traumas that lead to inflammation. And then it's being used a decent amount in myocardial infarctions in the cardiovascular world, and seems to have a neuroprotective effect. So once again, some of these things can be used by themselves, but I think can have synergistic effects. Going back to traumatic brain injuries, we know that traumatic brain injuries alter the way the immune system works, which leads to things like microglial priming. It leads to inflammation. It leads to too much tissue damage. So, can we use something to modulate the immune system, calm it down, and then use something like thymosin beta 4 to then improve tissue healing, right? And then doing that on top of appropriate rehab to improve cognitive function or their inner ear and their balance, along with things like hyperbaric oxygen therapy to further improve the healing. This is where I think things really get exciting. And this is what we really try to do at IHS is always be on the forefront. And we're always asking ourselves, how can we be better? How can we better serve patients? And how can we get patients better faster? It's, you know, as you work with patients, if you can get them better in 6 months and then 4 months and then 3 months, because some of these technologies allow, I'm always, wide open and trying to learn so that we can improve patient outcomes as quick as possible, because that helps save patients time and money versus going to a million different doctors and spending so much money. So that's what I have for peptides tonight. Like I said, I know we kind of talked about a lot, but I wanted to keep it kind of short and keep it open for questions that people have. Because, like I said, there's a lot to talk about, and there's so many different peptides from different types of secretagogues in the pituitary gland, different growth hormone ones, all sorts of things. These are two really cool immune modulating and one really cool tissue healing one that Jolene, our nurse practitioner, is using, and we're using synergistically with some of our other therapies, like I said, in TBIs, chronic viral infections like Epstein-Barr virus, and autoimmune diseases. So that's kind of all I have for tonight. So, like I always kind of mention, the important things are to act sooner rather than later, right? And then the important thing is never too late. And like I said earlier, this is what I'm trying to always do is to find new technologies to help individuals. And peptides for a long time were something I was very interested in, and I thought something that could be a real game changer in improving patient outcomes quicker. And so I'm very happy and excited that this is now part of our clinic for patients, because I think it's going to be really, really helpful. So if you're curious to learn more, we always offer free consultation. So even if you just want to talk more about peptides or anti-aging, or if you want to think you might be a good candidate for peptides, we can talk about that. Or if you just want to talk about your current case and see if we might be able to help you in some way, or if we think someone else may be a better fit for you, that's why we offer those free consultations. So I find that to be very, very helpful for individuals in being able to kind of sift through the healthcare arena. Okay. And then, like I said, it's myself, Dr. Stedman, and Jake. And if you want to listen to us more as we put out content, we are always on the radio at KLZ The Source or Haystack Radio Mondays at usually 12:30. And it's various topics like what we talked about today, or maybe thyroid conditions and things like that. And then the important thing is a lot of this can be done via telehealth as well. So I know we're in crazy times and some people don't venture out. We also have a lot of people out of state or out of the country, and this is where we can use telehealth. And what's really cool about some of these peptides is they can be injected sub-Q, and there's different methods that can be done at home safely. So there's a lot of different cool things that can be done with them. But I will open this time up for questions if any individuals have them. And we'll free up the rest of the time for that. So if you have any questions, just shoot them in the chat and I will answer. So if, oh, here we go. Okay, so we have a question. Is one or several tests needed to determine the need for this type of treatment? So that is a great question. And I wouldn't say there is a specific or even two or three tests that say you need thymosin alpha 1 or you need thymosin beta. The way I look at it, as just like with everything, is it comes to the whole clinical picture. So, to answer that question, I think there can be some labs that are important. So, if we look at like thymosin, let's say we're talking about thymosin alpha 1, if we have a patient whose immune system looks sluggish. Maybe their white blood cells are low, their neutrophils are low. They have really high viral levels of Epstein-Barr virus or cytomegalovirus. So they seem to have a lot of these chronic viral infections. That could be enough to warrant that something like thymosin alpha could be really, really effective. Um, or, a lot of times on some of these patients, I'll look at even more specific immune panels where we can actually look at those T cells. So we can look at T helper cells, we can look at the CD8 cytotoxic cells, and maybe we find that those are a little low. We may say, that mixed with some other things, maybe you would be a good candidate for thymosin alpha 1. Or going back to thymosin beta, some of these honestly have such good safety profiles, and most people do really, really well with them, even young kids. That there's a lot of individuals, like I said, with TBI, where a majority it's saying, "Hey, we know this improves tissue healing. Let's just add it in as kind of a protocol." So there's certain, I think, specifics you can get in, and then there's certain things where they're kind of like they can help almost anyone. Like I said, I think that thymosin alpha fits more into that chronic viral infection. So I'd say, to answer your question with labs, I think maybe a lot of positives of different viruses, maybe some positives with there's an autoimmune condition present, and then maybe a little bit more someone who has suppressed immune system, so maybe low white blood cells, low neutrophils, low T cells. Those could be some indications where some of these immune stimulating peptides could be beneficial, but there isn't a specific one marker or two markers to say you need this A equals B, if that kind of answers your question. But that was a great question. Okay. Any other questions? Well, don't see any other questions popping up. So if there are not, if there aren't any more questions, I will let you all go for the evening. Um, Thank you so much, everyone, to coming out. Like I said, we really appreciate you guys spending your time with us. I hope these are worth your while. Feel free to always give us feedback. Call the front and say, "I really liked that webinar. I didn't like that webinar," because these are for all of you, not for me. It's for all of you, and helping to empower you, educate you, allow you to ask the questions you need to providers. So if there's any kind of things that you guys want to hear, topics or things you feel could be better about the webinars, always let us know. We're always open to feedback. So thank you everyone for coming out tonight. If you have any questions, call the front. And we can always chat and answer any of your questions in regards to peptides. So thank you so much, and have a great holiday to everyone. If you're traveling, please be safe. And if you're staying in town, same thing, be safe. But I hope everyone has a great holiday season, stays healthy, and we will see you in the new year. Thank you so much.